Now, why does the clinical classification matter? And I need you to write this down, because if you don't distinguish between STEMI and NSTEMI in your board exam as well as in practice, it will affect the way you manage the patient. What do I mean by that? And this one, I need you to write it in your book right away. Please write it in your book. I'm going to take a pause here. If you like, you can even take a screenshot for your notes. For patients with STEMI, that is ST elevation myocardial infarction, their management is different from the way you manage a patient with NSTEMI. In STEMI, you do what we call emergency reperfusion, where you can do PCI or thrombolysis. And another assignment I want to give you is, please learn the contraindications for thrombolysis. You can't go into any board exam in these days without knowing the contraindications for thrombolysis. You need to know. So please, before you leave this class, I need you to, I was going to give it as an assignment, but I was like, let me just bring it up right away. Absolute contraindications. Number 1, active bleeding or bleeding disorders. Number 2, intracranial hemorrhage, cerebral vascular lesions, malignant intracranial neoplasm as well, ischemic stroke in the last 3 months, head trauma or spinal surgery, suspected aortic dissection where there's a tear in the aorta, okay? If the patient has severe uncontrolled hypertension, that's another absolute contraindication. Then when it comes to relative contraindications, if the patient has ongoing anticoagulant therapy. Number 2, the patient has had recent internal bleeding, that is 2 to 4 weeks ago, active peptic ulcer disease, and a patient who has been pregnant or who is currently pregnant or recently been in the postpartum state. So I hope this helps very well. I hope this helps.